My name is Shauna Cowdery, and this is my poster presentation entitled Importance of Nursing History for Nursing 346, Evolution of Professional Nursing. The historical analysis nursing history book that I chose was Making Room in the Clinic, Nurse Practitioners and the Evolution of Modern Healthcare by Julie Fairman. This book investigated the evolution of the nurse practitioner movement from the 1960s to the 1970s. It described the nurse practitioner movement as a result of nurse-physician collaboration to provide optimum patient care. This book took us through a journey through political, cultural, and theoretical matters and gender dilemmas that outline the definition, responsibilities, and acceptance of nurse practitioners. This book also depicts social, economic, and political issues between American Medical Association and the American Nursing Association. The nurse practitioner evolution created a significant foundation for health policies, including health maintenance organizations and improved interest in health awareness, disease prevention, and consumer-based services. History as a pedagogy. The evolution of nurse practitioner movement provided a solid foundation for nursing as it allowed for continuity as well as growth and change in the healthcare industry. Physicians during this time, around the early 1960s, underutilized the resources, such as nurses, despite physicians' shortages and threats to the health of many patients. The Bain Committee, which is part of the Surgeon General's Consulting Group on Medical Education, conceded that physicians could not carry out their increasingly complex responsibilities without the collaboration of other health professionals. History as evidence. Nurse Joan Linoff describes nurse practitioners as looking for an exam room of their own, essentially a clinical space in which to provide nursing care. This space is indeed a crowded one. Clinical practice undeniably hinges on where and how nurses and physicians work together, but it is also structured by economics, the political circumstances, expectations, and values of the patient, other providers, and various institutions. And it also encompasses much more than getting along, a concept that trivializes the most important aspect of healthcare, the clinical moment when provider and patient enter into a dialogue and a relationship. This quote provided voice as it emphasized the importance of resilient collaboration between physicians and nurses. It's imperative. Nurses must also understand their significance in the healthcare industry because they have potential to help lead transformation of healthcare by taking on advanced roles in providing care management. As a whole, the healthcare industry must shift from a healthcare system that focuses solely on illness to one that prioritizes wellness and prevention. What nurses can bring to the table in collaborating with physicians is wellness and preventative focused evaluations, wellness and health education programs, and programs that address different risk factors of preventable diseases. These factors are as equal, if not more important, than the disease-focused clinical interventions that physicians provide on their own. History as explanation. During the 1960s, the shortage of physicians and the influx of patients with medical care led to inconsistent access to medical care. Physicians were in command of healthcare plans, and they were the sole providers. They did not have any help. Nurses were only allowed to perform basic skills, and they were not appreciated or recognized for their contribution to healthcare. Nursing's body of knowledge has not been communicated in a way that promotes understanding of the complexity of nurses' work. The danger with this lack of communication is that nurses' work will continue to be invisible and devalued. We must communicate the complexity of the work we do and demonstrate our outstanding contribution to healthcare. Nurses will continue to be seen as task-oriented technicians rather than the professionals we are who provide complex care every day. Nurses in the 1970s, going into the 1970s, the evolution of the nurse practitioner movement advanced rapidly. This progression was made possible through rising public acceptance, policy decisions at the federal level that provided funding for nurse practitioner training programs, and incremental policy changes in state regulations that supported advanced practice for nurses. Nurses must utilize their voice to ensure scope of practice barriers are removed so they can continue to practice as independent providers when necessary and able. Understanding nursing history and the events that surround the profession can assist in shaping our understanding of health policy. History ultimately informs policy by showing the value of local entrepreneurial solutions to national health care problems. During this time, when the evolution of nurse practitioners was advancing, nurses were beginning to be encouraged to receive higher education and practice to the full extent of their training. Physicians improved their collaboration with nurses and other healthcare staff, and patients began receiving more consistent medical care, which led to reduced emergency room visits and hospital admissions. With nurses utilizing their voice to ensure that they can continue practicing independently or right alongside with physicians, nurses need to assist by communicating with insurance companies, hospitals, and doctors' offices to convey the importance of high-quality, lower-cost care. Looking forward, everyone must understand that nurses have the power to renovate the healthcare system and improve the health of many. Thank you.